I'm Pia. I'm the mobilization coordinator for the 2022 re-election of Alexandria Ocasio-Cortez. I do the national outreach for the campaign. You probably heard from me. I chose this topic, understanding the US medical system finances, because I think healthcare is a human right, that many of the issues in our community in New York 14 and nationwide can be alleviated if we had more healthcare access. It is Pride Month, and I wanted to take a moment and honor Pride Month. New data from a national survey conducted in 2017 showed that the LGBTQ people experience discrimination in healthcare settings. That discrimination discourages them from seeking care, and that LGBTQ people may have trouble finding alternative services if they're turned away. So I want to honor Pride Month. It's a great time to recognize the contributions of your LGBT peers, learn a little bit more about LGBT history, and celebrate diversity, and also consider a way that you can contribute to creating a more inclusive society. So what will we cover today? We'll talk about health insurance basics, health services, AOC wins, and what AOC has done lately. The national health expenditure, future trends, and a call to action. So the knowledge of the history of healthcare is essential to understanding the main characteristics of our medical delivery system as it exists today. For example, the system's historical foundations explain why a government-run national healthcare system has not materialized in the United States. This is unlikely what exists in Canada and Great Britain, for instance. Instead, the United States has predominantly a private healthcare industry. It also received a fairly substantial amount of financing from the government. So traditionally held American cultural beliefs, the values, the social fabric of American society, the tech advances, the economic constraints, the political opportunities, and the ecological forces are the main factors, the main historical factors that have shaped the US healthcare system delivery. I want to share this tweet from Alexandria. To this day, I work so my campaign staff is better insured than I am. But as an employer, I hate that their healthcare is tied to employment. When people get debilitating diagnoses, why does our system force us to stress about care ending with employment rather than getting better? So how did we get here? So the first broad coverage health insurance in the United States, it emerged in the form of workers' compensation. So this system was originally designed to make cash payments to workers for wages lost because of job-related injuries and diseases. And then later, the compensation for medical expenses and death benefits for survivors were added. So between like 1910, 1915, workers' compensation made rapid progress here in the United States, and its views and the widespread acceptance. Some reformers believe that because Americans had been persuaded to adopt this insurance against industrial accidents, they could also be persuaded to adopt a more compulsory insurance against sickness. So workers' compensation served as the trial balloon of the idea of government-sponsored health insurance. But however, the growth of private health insurance, along with other key factors discussed here, it prevented any proposals for national coverage. From taking hold in the United States. So the three main factors that explain how health insurance in the United States became employer-based, it was because during World War II, period, the Congress imposed wage freezes for an attempt to control wartime inflation. And in response, many employers started offering health insurance to their workers to compensate for the lost raises in their salaries. So in 1948, the US Supreme Court ruled that employee benefits were a legitimate part of union management negotiations. So health insurance in turn became an important part of collective bargaining between unions and employers. And then in 1954, Congress amended the Internal Revenue Code to make employer-paid healthcare coverage non-taxable. So in economic value, employers paid health insurance was equivalent to getting salary without to pay tax on it, which provided an incentive to obtain health insurance as an employer furnished benefit. And then in later years, employment-based health insurance expanded rapidly, and private health insurance became the primary vehicle for the delivery of care in the United States. So some employee characteristics that influence health insurance offer rates from an employer, it's how large the employees there are in a business versus a small employer. It's also the number of wages versus low wage earners, full-time workers versus part-time workers, and the percentage of workers versus older workers. So a national healthcare system is influenced by a host of factors. So it includes politics, economics, tech, society, culture, and physical environment and demographics and other population characteristics. So today, together, these external forces have shaped the course of healthcare delivery in the United States. The US healthcare system stands in stark contrast to the healthcare systems in other developed nations, which have centrally controlled the universal healthcare systems that authorize care, financing, payment, and delivery to all residents. So the healthcare system in the US is not centrally controlled. Rather, it's financed publicly and privately, and therefore various payments, insurance, and delivery mechanisms. So private, about 55% of total US healthcare expenditure, and the government finances the remaining 45%. So right now, the US is a hotbed of research and innovation in medical tech. Science and tech advances often create a demand for new service, despite the shrinking finance resources. So other factors that also contribute to the increased demand for expensive high-tech care is patients often assume that something new and innovative represents the best quality, and physicians often seek to use the best quality. I want to take a moment and I want you guys to think, what is health? What is health to you? What does health mean to you? And in the United States, the concept of health and healthcare have largely been governed by the medical model, or specifically the biomedical model. So under medical model, health is defined by the absence of illness or disease. And this perspective, it emphasizes diagnosis and intervention to treat disease or symptoms. So optimal health exists when a person is free of symptoms and does not require any treatment. Thus, the medical healthcare system delivers of medical care or illness care. And then I want you guys to think of these questions. How should the US distribute healthcare? How much do you think your health is worth? Do you think someone you never met should make these decisions? You're welcome to type it into the chat box and we can read it out loud. Mental health care. No, they should not. Anyone else? Fully comprehensible, equitable for everyone, guaranteed from birth. Healthcare is taking measures to minimize negative outcomes while maximizing the ability to live a meaningful and well-rounded life. I really like that response. Preventative care. I completely agree. Don't wait for illness to treat. Yes, Stephanie. Universal health care. On the subject of women's health, no man should be making a decision of a woman's health care. Single payer, to be clear. Insurance regularly denies me of MS. Healthcare will also require addressing political influence that corrupts the food chain. I completely agree, Matt. Don't forget about public health. The coronavirus showed us how our public healthcare system is. These are all great responses. A public option, at least. Access to safe water and food, that's really great. I love all these responses. You guys nailed it. So we're talking about a value system that helps us define society's ideals. The traditional cultural belief and values in the US, they've been based on market justice. And what is market justice? Well, the traditional cultural beliefs and values in the US, they've been based on conservative principles of market justice, with social justice principles taking a secondary place. In recent years, though, American society has become increasingly more defined by various subcultures, and this is due to the influx of immigrants from different parts of the world, diversity, which promotes social cultural variations on how people view their health and their attitudes and their behaviors concerning illness and death, driven by also the changing demographics. The foundational belief of the value of the US culture are in a state of flux. In a perfect world, healthcare, production, distribution, and consumption would have an equal impact on all members of society. Well, unfortunately, no society has found a perfect, equitable method to distribute limited economic resources, and inequalities are inevitable. So societies therefore try to allocate resources according to guiding principles. What are some principles that you guys think of when you think of distributing healthcare? You can put it into the chat. The fundamental question of distributing justice or equity is how a healthcare system can make essential services available to all members of society. So this concern about equal access to healthcare services is addressed by theories of market justice and social justice. And this is where we're going to talk about social justice. So according to the market justice, market forces are best achieved to have a fair distribution of health services in a free economy. And in such system, medical care and benefits are distributed based on a person's willingness and ability to pay. So it's a commodity, exactly. So people are entitled to purchase a share of available goods and services of interest. And they must purchase these goods and services with financial resources equated to their own legitimate efforts. That's what market justice thinks or has the philosophy of. This is how most goods and services are distributed in a free market, and to give people something they did not earn is considered morally and economically wrong. And thus this principle of market justice makes the following key assumptions: that healthcare, like any other economic good or service, can be governed by a free market force or supply and demand. And individuals are responsible for their own achievement. And when individuals pursue their own interests, the interests of society as a whole are best served. And then people make rational choices in their decisions to purchase healthcare products and service to rectify their health problems and restore their health. So people, when they're consulting their physicians, they know what is best for them. This implies that people place, to a certain degree, they trust their own physicians. And in a free market, rather than the government, they can allocate healthcare resources more efficiently and equitably. And under a system characterized by market justice, healthcare production is determined by how willing and able a customer can purchase healthcare and products in a prevailing market price. So in a free market, those with insufficient incomes, they're not insured, they face financial barriers to access health, and together prices and the ability to pay, they ration out the quality and the type of services consumed. And these limitations to access are referring to the demand side of rationing or price rationing. So market justice emphasizes on the individual rather than having the collective responsibility for health and purposes, private rather than government, solutions to social problems of health. And you kind of saw this during COVID, right? Where people who did not want to wear a mask during the height of the pandemic, they believed that it was their individual choice. And that's the principle of market justice works well when it comes to allocating economic goods with unequal distribution, but it does not affect the greater society. So people live in different sizes, styles, homes, they drive different types of automobile, they spend money on different things, on individual success. However, market justice principles, it fails to rectify critical concerns such as crime, homelessness, the inability to access to proper education, which significantly weakens our fabric of society. So recognizing these shortcomings of a free market, many Americans suggest that healthcare is also a social concern. So the idea of a social justice is at odds with the principle of capitalism and market justice. So according to the principle of social justice, the distribution of healthcare is societal rather than the individual responsibility. The goal is best achieved in central agency, usually a government, and it takes over the production and the distribution. So social justice regard to healthcare as a social good, not an economic good, to be collectively financed and available to all citizens, regardless of their individual ability to pay. Most industrialized countries long ago reached a consensus that healthcare is a social good. Public health is also oriented as social justice. So in a social justice system, the inability to obtain healthcare is due to lack of finance resources considered unjust. So the principle of social justice is based on the following assumptions: that healthcare is different from other goods and services. The responsibility of health is shared. Individuals are not totally responsible for their ill health because they do not control some factors such as economic inequalities, unemployment, unsanitary conditions, or air pollution. So society has an obligation to the collective good. An unhealthy individual is a burden on society. A person carrying a deadly infection, for example, it poses a threat to society. Society is obligated to eliminate this and provides the healthcare to the individual because this benefits society as a whole. So the government, not the market, can create a rational plan that better decides the quantity of healthcare to produce and how to make it available to all citizens. So in a social justice-based system, no country can afford to provide unlimited amounts of healthcare to all citizens. The government must limit the availability of certain services by deciding, for instance, how tech is distributed and who has access to certain high-tech services. This concept is referred to planned rationing or supply side rationing. So currently, the US healthcare system, it's not a market justice-based system because the US delivery does not follow the principles of free market system. It shifted away from market justice when we created Medicare and Medicaid. And since then, the move towards social justice has been gradual, as most recently as the ACA. So currently, less than half of the healthcare financing in the US, it comes from government. The government also plays a major role in exercising control over the healthcare system through various policies for insurance, for provider payment, available for new drugs, procedures. We all saw that in the last 2 years, medical research funding. So in the US, the principles of market justice and social justice complement each other. So market justice drives private employer-based health insurance, mainly in middle-income families. And in contrast, the social justice, the basis of publicly financed Medicare and Medicaid, and children's health insurance program, and workers' compensation program. So these two principles, they collide. However, whenever a significant number of uninsured are unable to afford insurance, are unable to afford insurance and other ineligible Medicare and Medicaid, they provide a significant number of people uninsured. So in contrast to individual health, public health focuses on improving population health and well-being. As an example of social justice, government plays a central role in developing and enhancing the public health at the national, state, and local level, and evaluates the effectiveness of the public health system, along with national surveillance systems to consistently track these indicators. So determinants of population of health, they play a major role in evaluation. So the determinants of health, it acknowledges the effects of demographic, social economic status, individual behavior, community inequalities, and their influence on health. So health and health determinants are multifactorial. So medical care, while important, is only one factor that contributes to the health and well-being of others. So factors such as physical, social, cultural, economic, environment, and even your genetics, they all play a role in determining health and well-being for individuals and the population. So nowadays, healthcare delivery is primarily driven by the medical model, which emphasizes illness rather than wellness. So many efforts to improve healthcare delivery, they have failed to produce a proportionate impact on the improvement of health. So applying a holistic concept of care and integrating medical care with preventative and health promotion efforts, it would significantly improve health. Although it would require a fundamental change on how Americans think about health. Also, paternity leave here in the States is a joke. Yes, I agree. It would also require individual responsibility for behavior and community partnerships to improve both personal and community health. So understanding the determinants of health, health education, community health assessments, and national initiatives such as Healthy People 2020. So the US healthcare system has gradually transitioned towards an emphasis on social justice. Yet not all Americans can enjoy equal access to care. So to improve the nation's health and reduce disparity among the vulnerable populations, both social and medical determinants of health, they need to be addressed. So of all the developed countries, the United States spends the most on healthcare. Nearly 17% of the gross domestic product in 2016, it was in healthcare. And many US residents have limited access to even the most basic care. So access to the ability of an individual to obtain healthcare when needed. So in the US, access is restricted to a person who, one, has employer-based health insurance, 19% now, thank you. Two, they're covered under a government-sponsored healthcare program. Three, they can buy insurance with their own funds. Or four, they can pay for services privately or obtain services through a safety net provider. So healthcare insurance is primary, but not necessarily a sufficient means for obtaining access to care. So despite the expansion of health insurance, some people still face barriers to access. 1/3 of physicians do not take Medicaid insured patients for primary care, consistent basic routine. Uninsured individuals, they can't even visit a physician without making out-of-pocket payments. And this is the basics. Those who can't afford it, they usually wait until their health problem progresses and it becomes worse. And when they may be cared for in an emergency health department, and usually the ship has sailed. So experts believe that the disparity in this access to primary care services are the main reasons why the US lags behind other developed countries. And the US, it has a lot of racial disparities and life expectancies. So in terms of financing, financing refers to any mechanism that gives people the ability for healthcare services. So for most people, health insurance provides the financing to access to healthcare. Some uncompensated or charity care, mostly provided by free clinics. Community is delivered to those who have little or no means. But however, it's not available in all geographical locations. You can see that in New York 14, you can see in rural America. So it's complex. The complex of financing, the complexity of financing is one of the main primary characteristics of the medical care delivery in the United States. So most health insurance is privately financed. And then certain categories of people, however, they become eligible for tax-supported public health insurance. Almost all Americans age 65 and older, they qualify for Medicare, which also covers some younger adults with disabilities. So other public programs such as the VA, Departments of Veterans, and the military health system, they cover a relatively small number of people. So under the ACA, the public got some coverage, but not all. So today in the United States, it's the only industrial country, and we fail to guarantee healthcare to people. So each year, thousands of Americans, they die prematurely because they are unable to afford necessary medication or preventative care. And also the wealthy drug companies, big pharma, healthcare providers, and insurers can even make more money. So to me, it's a moral outrage. As Alexandria likes to say, Medicare for all is not a pipe dream. Every other developed nation in the world does this. Why can't America? So we're building this mass movement for Medicare for all. So it's a single healthcare system that will allow every one of us to receive quality healthcare that's free at hospitals, pharmacies, or doctor's office. Our plan to cover prescription drugs as well as primary, mental, dental vision, women's health, emergency room care, and to top it all off, we're going to save money once implemented. So the United States, we spend about twice as much money on healthcare as any other industrialized nation, but our healthcare outcomes are worse than any group. And even we use the same amount of health services as people in other countries. This is because we're not just paying for the care we need, but also for the profits of wealthy drug manufacturers, insurance companies, and medical firms. This is why in office, Congresswoman Ocasio-Cortez, along with activists and organizers, they pressured pharmaceutical CEOs into making life-saving therapy more affordable and accessible. So this is the promise for Medicare for all. So single-payer Medicare for all, it would remove excess healthcare costs to you by replacing the private insurance industry with a government-run insurance. So rather than spending money to fund departments that deny people care, I want you to focus, I want the US to focus, I want we to focus on resources on keeping America healthy. So, and with one insurance provider working on behalf of all of us, we will be able to negotiate much lower prices for drugs, x-rays, and other critical cares. So Congresswoman Alexandria Ocasio-Cortez, what is she fighting for? She wants to guarantee quality, comprehensive healthcare for all. She wants to lower overall healthcare spending by eliminating the private insurance industry. So the rise in healthcare expenditure has been attributed for complex interactions of many factors. So the general inflation in the economy is a prominent cause of healthcare spending because it affects the cost of producing healthcare services through more tangible as higher wages and a cost of supply. So apart from general inflation, numerous other factors influence medical cost inflation. So third-party payment healthcare is among the few services for which a third party, not the consumer, pays the lion's share for most of the services used. So whether the government or a private insurance company foots the bill, individual patients pay a price that is far lower than the actual cost service. And then there's the growth of technology. So the introduction of intensive use of tech, and it directly impacts the escalation of healthcare costs. So developing new tech is expensive, and research and development costs, they're included in the total healthcare expenditure. So once technology is developed, it's more available to create demand for it in use. So the introduction of new tech, kind of like all our medical records, if they take insurance, they have to do electronic medical records. So the new tech raised consumer expectations about the ability of medical science. And it also, unsurprisingly, it also attempts to limit the diffusion of certain expense in tech in the US. And also, we have an increase in the elderly population. So during the past 100 years, life expectancy in the US, it increased, it decreased. Life expectancy increased by 30 years, from 47.3 in 1990 to nearly 78 in 2015. So the life expectancy and the aging baby boomers, the population, it became a notable increase in the total US elderly population. So the elderly consume more healthcare services compared to any other age group. The increasing costs that are nearly 3 times as high as the general population. And then our medical model of healthcare delivery. So the medical model, it emphasizes medical intervention after a person becomes sick. So kind of like you go to the hospital and the ship has already sailed. So rather than focusing on prevention or lifestyle behaviors to promote health, although health promotion and disease prevention are not the answer to every health problem, these principles have yet to be accorded their rightful place in the US healthcare. So more costly healthcare resources must be used to treat many health problems that could have been prevented or delayed. So the multi-system and administrative costs. So admin costs, it includes costs associated with healthcare insurance marketing, enrollment, contracting, providers, claiming process, monitoring, handle denials and appeals. And because it's complex and it's a multi-payer system, the cost often, it duplicates everything. And it accounts for as much as 25% of total healthcare costs in the US. So a single payer healthcare system, it may lower admin costs as well. And then there's defense medicine. It's the over documentation of when you see a doctor where they spend more time documenting than actually spending time with their patient. So the US healthcare delivery system is riddled with legal risk for providing that encourages to use defense medicine. And that's what's it called. It's basically the over documentation, making sure that the doctor is not liable of anything and they documented everything, rather than focusing on the person. So the practice of defense medicine involves tests and services that are not medically justified, but it's rather performed in order by a physician to protect themselves against any potential malpractice lawsuits. And then there's waste and abuse in healthcare. And it's a fraud and it's a major problem in Medicare and Medicaid programs. It may also occur when more services are provided than are medically necessary. So when services that were not actually provided are billed to a third-party payer. So the latter practice may entail billing for a higher price service than actually it's delivered, or picking a more favorable diagnosis as a diagnosis-related group payment scheme. And then there's practice variation. So these differences in practices are referred as a small area variations. The recognition that the fact that the observed differences in practice patterns were associated only with certain geographical areas in the US. So such a variation practice is intense, which can be a great twofold. So it cannot be explained by age, gender, race, or price variation. So small area variations, they signal gross inefficiency in the US and the healthcare delivery system, because ultimately this increases the cost without actually improving the outcome. So the term of cost carries different meanings in the delivery of healthcare. So depending on the perspective one takes. So there's 3 distinct meanings that are presented here. First, like most of us, when consumers and financiers speak of the cost of healthcare, they're usually referring to the price of healthcare, such as a physician's bill or the premiums that both employers and employees pay when purchasing health insurance. Second, from a national perspective, so healthcare cost refers to how much a nation spends on health services, so commonly referred to as healthcare expenditure, or healthcare spending. So these terms primarily they reflect the consumption of economic resources in the delivery of healthcare. So such economic resources include health insurance, skill of healthcare professionals, organizations, institutions of healthcare delivery, pharmaceuticals, medical equipment, supplies, and new medical discoveries. So many of the health disparities may be addressed as at a community or local level. So neighborhood poverty, the lack of health and social welfare resources, and the lack of societal cohesion that can contribute to the inequalities in a community. So understanding the multidimensional risk and the needs a community can equip on local agencies that are responsible for designing and addressing health disparities in their communities. So community partnership. Community partnership reflects the priorities of a population, and they're often managed by community members to minimize cultural barriers and improve community buy-in to health improvement programs and address disparities using community approaches. But it has several disadvantages. It has several other advantages. Local businesses and other partners can often have stake in local health causes, and that can really help members of the community. So community strategies, they improve health and community solutions, and these decision-making in which community members are involved. So moreover, many community programs run by nonprofit organizations, they can be subsidized by federal, state, or local funds. And thus, they offer services at lower cost than private health organizations, which they often are obligated by shareholders to price services competitively. So for example, the rise in childhood obesity. Many schools are beginning school-based nutritional programs, and these multi-component interventions that they involve the food service program, the food service department, teachers, parents, students, admin, and teaching students proper nutrition in the classroom while educating parents to make a child curb childhood obesity. So public policy, it directly guards the welfare of a nation. And that's something I want you guys to think about. So through the production of safety regulations, whether it's gun control or screening food and water resources, or enforcing safe work environments and other ways. So with fewer resources, however, the vulnerable populations are uniquely dependent on social and public policy for programs that address basic health, nutritional safety, and social services. So what has AOC done lately? So in May 2021, AOC, she requested nearly $7 million in funding for 10 community projects that would serve New York 14 congressional district. The community project included youth violence intervention, educational support, workforce training, in green jobs and home and healthcare, and support for the Plaza del Sol Healthcare and Elmhurst Hospital. So Elmhurst Hospital, it will receive $3 million towards their renovation for their OBGYN inpatient facility in order to provide a more modern, safe, and comfortable family-centered environment. A patient and a family-centered environment, it leads to increased patient satisfaction and better health. So it's imperative to provide equitable maternal care to the working class and immigrant communities surrounding Elmhurst in Queens. Then Jacobi Hospital, the hospital I was born at, Jacobi Hospital will receive funding to add mental health services under the umbrella of Stand Up to Violence, the SUV program. It was modeled after the Chicago-based Cure Violence program, and it addresses youth violence in Bronx. It works by outreach workers to respond to shootings, to prevent retaliation, and to assist family members who have been killed or injured, and also works with a mentor at-risk youth on educational and job opportunities. They are proposing an addition to the emergency room with social workers, caseworkers, psychiatrists, art therapy, music therapy, to help treat trauma and violence. So it would allow them to offer a wraparound therapeutic approach to help address the root cause of youth violence. And then in Queens Community House, it's seeking funding to create a family support counselor at each of the 2 alternative high schools they operate, so Corona and Elmhurst, in partnership with New York Department of Education. It will help students who either have dropped out or fallen behind on credits. And currently, the Queens Community House has one of the FSC who provides case management support across 5 different schools. So last year, enrollment in those 5 programs and youth development centers was around like 1,500 students. And during the peak of COVID in New York, community health centers had to pivot quickly to telehealth. And an investment in telehealth services will allow Plaza del Sol to increase the number of individuals they can reach. So this will enhance patient care service, improve communication and coordination of care, and self-management of health as well. And then in Sunnyside Community Service, they request funding to complete their home health aid for training program. It's an innovative workforce development program that helps unemployed individuals, primarily immigrant women, to enter a care ladder in the healthcare field. This request funding will allow 300 community members to receive training and get the assistance of the job coach, soft skill training to supportive services. So also the Sunnyside Community Service requests funding to the Institute, the Safety Learning and College Access Program at Woodside Housing Cornerstone Community Center. It's a public housing-based community center in Woodside, Queens. And funding will this support 70 young people who are primarily low income, people of color, to supplement existing educational service to offer the Too Good for Violence curriculum, which teaches like social learning theories to develop interpersonal, pro-social, and peaceful behaviors that are facilitated by trained staff in order to build a safer relation and community. So healthcare reform in the United States is currently at a crossroads. I think we can all agree with that. It does not appear that any major initiative will emerge. The Republicans in power have lacked the fortitude to come up with a solution to the problem, and many Democrat counterparts have opted to the status quo. I think we all could agree with that. And some features of the US healthcare delivery have remained stable in recent years, but the future will be determined by how certain forces of change interact. This can be based on Republicans' campaign promises, healthcare reform. But some of these forces, such as demographic trends, will follow a foreseeable course, and it's based on some predictions. And it's difficult. For instance, it's really impossible to predict the future course of the US economy. The employment, family incomes, all of this will affect what individual Americans and the nation may or may not be able to afford in the wake of our rising healthcare costs. So it's clear, however, the US healthcare stands at a tipping point. It's at the convergence of it's graying, it's highly consumptive population, but we have this increasing limited finance and human capital resource with we are at a shortage, well, not technically a shortage, but more for a healthcare provider, there are more patients that they have to see. So some of the US healthcare delivery features, they've remained stable, but serious issues remain in the areas of coverage, cost, access, and affordability. So a new wave of healthcare reform, it's slowly beginning. And however, there are serious challenges that lay ahead. Unless the US can control its rising consumption of healthcare resources, the cost that it's associated with that use and the put that in the economy on a growth trajectory. So eventually the nation will have to come in grips what it can reasonably afford in terms of healthcare. So the existing model of healthcare delivery is also likely to undergo major changes in the future. I think we can all agree on that. So maybe it's going to be value-based shared savings, community outreach, virtual consults, or tech-driven home care. So another critical area that must be addressed is the short care of healthcare professionals. So while the US population, we're growing rapidly, we're rapidly aging, little has been done to address the need for geriatric care. So addressing the workforce diversity and training or other looming challenges that we have. And this can really put a threat to the adequacy of healthcare workforce in changing a demographic landscape. So to combat the global health threats, the international readiness to respond quickly, these challenges, they must be faced. So we could have a global health threat like COVID and not be managed in a timely fashion. So these are some things to consider. So many of these developments that is happening in the US, it will likely shift the focus on medicine from the acute phase of illness to prevention and healthcare. And that's kind of where we see in terms of trends. So what to do next? Medicare for all. Medicare for all, it would lower your monthly bills. How? It would eliminate copays and unexpected expenses. Now, lower and middle income families enrolled in Medicare for all would still pay less overall. Medicare for all stands to give people a raise, but how? The amount that employers currently give to private for-profit health insurance companies could otherwise go to wages. Medicare for all will lower the cost of health, but how? If more people join Medicare, Big Pharma will have no choice but to negotiate with them and lower prices. So what is Medicare for all? When we say Medicare for all, we're calling for a nationwide universal system of healthcare where individuals, they pay directly to one public agency, and in return, the individual receives all medical necessary services, including primary care, inpatient, outpatient, emergency, drug prescriptions, durable medication, equipment, hearing services, palliative care, mental services, substance abuse. So can you imagine a nation where patients have their choice of physician, providers, and clinics and practice? So that's what Medicare for all is. Imagine a country where there are no copays or deductibles. That's Medicare for all. Imagine the money our communities would save and the people that we would save by cutting out unnecessary paperwork and insurance from company profits. That's Medicare for all. Imagine the ease of mind that comes with lowering drug prescription costs and simplifying how you would pay healthcare. That's Medicare for all. So before the pandemic, over 30 million people in the United States were without healthcare, and with another 75 million classified as uninsured. So now, as a result of COVID, there's approximately 40 million people who lost their job, in the last 2 years, and along with it, their employer tied healthcare coverage. So in the midst of a pandemic, this is why Alexandria is calling to provide medical access to those without insurance during this pandemic. Medicare for all uncouples healthcare from your job. It allows people to receive quality care that is affordable at a hospital, pharmacy, or doctor's office. It'll cover everything, primary, mental, dental, women's health, an emergency room visit, in addition to prescription drugs.
Thank you so much, Pia. This has been really fantastic stuff. When Pia first said that she wanted to do this as a project, I thought it was fantastic. I'm very impressed with how we've shaken this out tonight. So I also want to thank everyone for putting such great feedback and comments in the chat. Y'all are having some great ideas in there. I see some really good commentary too. We're approaching the end of the session today. So we're going to leave you with a couple things. So I've seen it a couple times in the chat now, people asking, what can we do? Like, how do we make this work? Why is it Medicare for all pass it if it's such a good thing? Well, as we all know, one of the main obstacles to Medicare for all is the insurance companies. They're very powerful. They're very rich. They spend millions of dollars lobbying members of Congress every single year. And for the most part, they're very successful, right? So we know that without candidates in Congress and in our local state legislatures, without candidates who refuse to take insurance money, we might never get there. So there's lots of different ways that we can take action in terms of how we can get to Medicare for all. There's an electoral and there's also a non-electoral way, right? Because while Medicare for all is very popular across the country, a lot of people don't know what it is. And part of the program, part of the campaign is not just to elect members of Congress and members of local state legislatures to support Medicare for all, but to get the public behind this as not just an idea, but something that is feasible and doable. So our first call to action to you all is to join us for a phone bank. We run phone banks just about every Saturday. They're at 1 o'clock Eastern time on Saturdays, and we call voters in our district in New York 14. We talk about what AOC's been up to, and actually the number one issue that voters bring up to us is healthcare. That is the number one thing we talk about, followed closely by gun control, criminal, and safety is a big thing too. So there's our page where you can sign up for events there. Alexandria is advocating for healthcare as a human right, safe and affordable prescription medications, and she is a co-sponsor on the Medicare for All Act in the House. So that's the first call to action. Our next call to action is to focus on the state level. Since there is so little movement in Congress these days because Republicans block just about everything, and also members of the Democratic Party have chosen to block parts of Biden's agenda, we can accomplish a lot through state legislation. Just today, if you're paying attention at all, in New York State, we are so close to passing something called the Build Public Renewables Act, which is a huge piece of climate legislation that would allow the state of New York to build renewable energy. This is something the federal government cannot pass in its current state, but that we have a real chance to do on the state level. Some states actually have single-payer healthcare bills that have been introduced. In New York, we have the New York Health Act, and in California, we had a California single-payer health bill that unfortunately was voted down last year, but it's not dead. They can bring it back again. I see a comment here. Yes, you can join our phone banks from anywhere in the country. You don't have to be in New York to join our phone banks. So if we want to support state and local candidates, Alexandria just endorsed an entire slate of folks. It's called the DSA for the Many slate here in New York City and in the upstate area as well. These are 10 candidates who all support the New York Health Act, who would all be fantastic representatives, and none of them take a single dime of corporate money or of insurance lobbyist money. So that link we'll send around as well, but it's just fortheturnout.nyc, and you can call, make phone calls and canvass door to door with some of these candidates here in the city. If you're not in New York, there are candidates up and down the ballot in almost every state in the country who are advocating for Medicare for all and better medical services and better medical access for Americans. You can find them through all kinds of different ways, but on the next page, I'm going to show you a place where you can look at some of them too. So you can also organize for Medicare for all outside of elections. Elections are not the only place to organize. Alexandria says it herself. Elections are just one part of this movement. It's not the be all end all. The movement doesn't end when we elect AOC, when we elect Bernie, whoever. That is just one part of it. I want to put you all on to two organizations today. The first is called Be a Hero. Be a Hero is an organization founded by a man named Adi Barkan. Adi Barkan has a degenerative disease. He's in a wheelchair and he is dying. And he has pledged the rest of his life to fighting for Medicare for all, however he possibly can. He has had sit-downs with President Biden, with Bernie Sanders, members of Congress, senators, etc. He and his organization do fantastic work. They work around the country. They're very active in the Northeast right now, I know. And they're a grassroots organization for medical care for all and for Medicare for all. The second organization I want to put you all onto is called Physicians for a National Healthcare Plan. I've seen that we have a few healthcare professionals here on the training today. I encourage you especially to take a look here. Physicians for a National Healthcare Plan is a nationwide group of doctors, nurses, healthcare professionals, and grassroots activists. So anyone can join. They don't only do grassroots organizing, they lobby Congress, they lobby state governments, they lobby individuals, right? They do all kinds of really good work. They have an activist starter kit that they've put together on their website. It's a great kit. It gives you all kinds of tools you can use to start organizing in your communities. And they also have a guide for how to lobby your legislators and how to plan an in-district lobby visit. A lobby visit is when you and your friends and your affinity groups, you get together, you go to your state capital like Albany, Sacramento, Olympia, wherever you might be, right? You meet with your legislators and you tell them what your needs are and what your wants are, which could be Medicare for all or a statewide single payer program. So PNHP has an entire toolkit for you to learn about how to do that and how to get that going. Blue states, red states, across the whole country. So get involved, take action.
Thank you. It's a pleasure to talk about this topic, and I hope to see you guys on a phone bank